Okay, so now to move on towards the inspection part of the chest examination, we'll be looking for a few basics, right? So the first thing that we need to look for so we're looking at the chest, and now we're looking for the shape and symmetry of the chest. But before we get to that, let me tell you about the diameters of the chest. So when you're looking at it this way, this is the transverse diameter of the chest, and then this would be the anterior-posterior diameter of the chest. So normally, obviously, the transverse diameter is way more than the anterior-posterior diameter of the chest. But in certain conditions, for example, like chronic obstructive pulmonary disease, you could have something which we call as a barrel chest. Now, what is a barrel chest? The barrel chest would be where the anterior-posterior diameter is more than the transverse diameter, and we call this as a barrel chest. Next, we'll be moving on towards the other abnormalities that we can see on the patient's chest So we'll be looking for something which we call as the funnel chest. The funnel chest is where there's depression of the lower sternum. So you'll be looking at somewhere over here, right? And for some degree of an inward depression. And that is what we call a funnel chest or pectus excavatum. After that, we'll be looking for something which we call as pigeon chest or pectus carinatum. Now, a pectus carinatum is when there's an outward protrusion of the upper part of the sternum and the costal cartilages. So there will be an outward protrusion. So you'll be looking for that as well. Next, we'll be moving on towards any lesions that we may see on the chest wall. So that may include surgical scars, for example, or any scars or any marks of invasive procedures that you can see, like chest tube insertion, for example. So that could be something that you could see. In addition to that, you're also looking for any prominent veins that may indicate. So if you have an increase in the number of prominent veins, you're looking at any superior vena cava obstruction, for example. So you're looking for any dilation of veins or any prominent veins that you may see. After this, you're also looking for chest wall movements. So you're going to be asking the patient to breathe in and breathe out, and you're looking at the chest wall. Now we're looking at the patient anteriorly, right? We also have to look at the patient posteriorly. So we'll ask the patient to turn. So we'll just move our mannequin towards the back, right? And we'll ask the patient to keep on breathing, and we'll also look at the movements of the chest on the back. While we're looking at the back of the patient, you're also looking for any surgical scars that may be there or any lesions that you may see. In addition to that, something that is very important is to look at the spine, right? Because you could have some abnormalities of the spine. You could have lateral bending of the spine that would indicate scoliosis, or you could have forward bending of the spine that would indicate kyphosis, or you could have a combination of both of them, which we call as kyphoscoliosis. So for the last part of the inspection, what we need to do is, so our patient was in a sitting position, right? We'll put the patient in a supine position, as so. And now we need to look at the movements of the abdomen, right? Especially during inspiration. So during inspiration, if there's inward movements of the abdomen, this could indicate certain pathologies like diaphragmatic paralysis. So we call this the paradoxical movement or the paradoxical inward movement of the abdomen during inspiration, which will indicate diaphragmatic paralysis. And that's it for the inspiration.